Hello and welcome to episode 1 of Undoctored with me, Pooja Avasti. Undoctored is a space where the experts speak your language in all matters health. In this episode, we take a look at the ABCs of cosmetic surgery. But first, plastic surgery. Like many inventions, discoveries, subjects, and disciplines which have their roots in India, plastic surgery also originated in India. The first mention of this is found in the Sushruta Samhita, which is named after the physician Sushruta, who lived sometime in the 6th or the 7th century BC. The Sushruta Samhita is a foundational text of Ayurveda. However, large tracts of it are devoted to surgery. It is here that we find the first mention of skin from the forehead or the cheek being used for the reconstruction of noses. But why would noses need to be reconstructed? Well, there could have been functional issues such as a difficulty in breathing and then an associated difficulty in hearing, or there could have been deformities by birth or because of injury. Remember also that in the not so good old times, chopping off one's nose was also a means of punishment. It was during the First World War when plastic surgery really came into play to reconstruct the faces and the limbs of the thousands of soldiers who had been injured in war. One of the most prominent surgeons who conducted some 11,000 such surgeries was one from New Zealand called Dr. Harold Giles. Post the World War, with so many trained surgeons around, plastic surgery came to be used for purely aesthetic and cosmetic purposes, hence the name cosmetic surgery. Remember that while plastic surgery, which is purely for reconstructive or functional purposes, cosmetic surgery is optional and meant to enhance one's looks or bodies, and yes, respond to that eternal human urge of looking forever young. Our expert for today is Dr. Amit Gupta, the founder and the chief surgeon of Divine Aesthetics in New Delhi. Dr. Gupta has so far conducted over 25,000 surgeries for clients from across the world. Remember, India today is a leading destination for people seeking such surgery. Dr. Gupta answers some of the most basic and muddled questions about cosmetic surgery. How safe is it? At what age can one undergo cosmetic surgery? Why does cosmetic surgery have such a bad name? But remember, beyond it all, cosmetic surgery, like any other surgery, is surgery. It is not magic. It is very important that you listen to your doctor's advice on maintenance and post-operative care. Also remember to peg your expectations to reality. I cannot, for instance, go to my surgeon and ask him that I be made to look like Katrina Kaif.
Technically, cosmetic surgery is actually not a word. The correct word is aesthetic surgery. And aesthetic surgery is a branch of plastic surgery which deals with the beauty aspects, or rather improving what nature has given you. It deals with making people more beautiful, have a better figure, deals with anti-aging, basically helps to evolve their confidence which they have lost from some problem which they perceive in their own body. A good patient who comes for aesthetic surgery or cosmetic surgery is one who is absolutely clear about their needs. They know what they want, they are well settled, and they know the results, they know what are the post-operative precautions, they know the limitations. They do not expect the sun, star and moons. They are very practical and in fact have clear goals as to what they should achieve. Someone who's not a good patient, there are very clear signs and symptoms. These are people who are extremely fidgety, or they expect that everything will change. They will dramatically transform from a 100 kg person to a Brad Pitt like model look. There are people who think that if they don't do this surgery, then their life will end. They are narcissistic, they are too self-obsessed. And these are people who are not good candidates for aesthetic surgery at all. A typical plastic surgery patient opting for aesthetic work can be in the age range of say 21, and it goes to almost 70, 75 years of age as well. The oldest patient I have operated is 78 years old. A typical range, however, is between 25 to 45 years of age, where the largest number of plastic surgeries happen. And it's gender neutral. It may be in men and women. Sometimes we do get patients who are as young as 16, especially in situations of male breast reduction, and we get patients coming for facelifts and anti-aging as old as more than 70 or 75 years as well. So some unrealistic expectations which a few patients who come for aesthetic work are, so I'll take it situation wise. So for example, if there's a lady who's opting for breast augmentation and she suddenly wants to get a 2000 cc breast implant, just wants to look huge and highly voluptuous, it's not an option. Then there are men who have lost hair and suddenly want to look like Salman Khan overnight. Doesn't happen, because one session of hair transplant cannot fill up the entire head with the absolutely natural density. Then, for example, if there's a gynecomastia or a male breast enlargement patient who's got extremely large amount of skin and breast tissue and they want an absolutely flat chest, it's not possible. A lady at 55 years of age wants to look like a 35-year-old lady, just not an option. We can of course make them look much younger, much more youthful than they are. But suppose they say we want to change the face or go back to what we were, or perhaps one of the most common requests we get is to look like a particular celebrity. Does not happen. It's way beyond the scope of any aesthetic surgery work. Aesthetic surgery or cosmetic surgery is 100% safe. Absolutely, without doubt, 100% safe. Some of the problems which do happen from time to time are not related to the science of cosmetic surgery. It is related more with problems of patient selection. The patient might have some other medical condition which they don't tell the doctor or the doctor has ignored. Skills of the doctor might not be as skilled as much as the procedure demands. Then there's no indication. A wrong indication has been selected. So for example, a patient, a woman who has breast sagging, undergoes a breast augmentation and no lift, the surgery will be absolutely counterproductive to their goals. So wrong selection, wrong indication, poor skills and over expectation. Sometimes patients expect way too much and that is just not possible. So these combined together have given some negative connotation to the word aesthetic surgery, because people believe that cosmetic surgery can just transform them from one person to another, which is not really the reality. Some of the major myths around aesthetic surgery. One, we can change a person. We can change the face of a person. We can completely change the body of a person. Not true. We can make you look more youthful. We can reduce your age by a certain number of years. But we cannot change the face of a person. And unless you as a patient look after yourself and follow all the post-operative instructions that we give you, a large amount of work that we put into your body will go waste. Second, aesthetic surgery is too expensive. It's absolutely not. Aesthetic surgery is not more expensive than conventional general surgeries or gynecology surgeries that are being done. It is just that some of the consumables used are very expensive. Say for example, a breast implant. The breast implant might account for 30 to 40% of the total fees of the surgery. And if we want to use the best, then it is a little bit more expensive. And third, it is not safe. I've heard horror stories, it can cause cancer, I can have headaches forever. Absolutely untrue. Aesthetic surgery is absolutely and absolutely 100% safe, provided you don't have any other medical problems, the indication for the surgery is properly selected, you are very clear with the expectations, and the doctor has good and reasonable skills to carry out that procedure. Selecting your doctor can be particularly very difficult. Today especially, because plastic surgery today is being done in 90% situations by plastic surgeons, and that 10% is actually being done by quacks. By quacks and frauds, I mean people who do not have a degree of plastic surgery. So for example, a dermatologist doing liposuction. I have to call that person a fraud because they are trained for dermatology and not for liposuction. A general surgeon doing breast implant surgery. Breast implant surgery is very specific. It is extremely detailed and meticulous. Only plastic surgeons can do it. So, cross speciality doctors getting into plastic surgery is one of the problems that are coming into this particular field. So, if I was to tell you how you can select a good plastic surgeon, one, please check their degrees, please check their credentials. You can check online or you can check with the office of the doctor. Second, years of experience. It is essential that when you select your doctor, that doctor must not be someone who just has 6 months to a year of experience. They must have at least about a decade of experience in these surgeries, and they must have done at least 500 to 1000 such surgeries. The doctor has to learn, they have to assist senior doctors, learn over a period of time, and only then carry out these procedures. Third, the area of work, area of surgery where they are going to be operating you needs to be well equipped to handle problems. If you are being operated in a small makeshift room, then there are red signals which should come up and you should not be operating at such a place. Fourth, be very sure the doctor who you are meeting is the one who's operating you. You do not want to be operated by some shadow surgeon, and so make sure that the doctor has adequate training in that particular field. It is essential that the general public, as well as people who are appealing to the general public, must understand that plastic surgery and aesthetic surgery does not mean vanity. It does not mean that it is surgery for the super rich only. 90% of our patients come from the middle income background, and at least 80% of these patients really need these surgeries. There are women who have heavy breasts, are not able to wear clothes, are being teased by people all around, are not able to marry. How is plastic surgery a vanity for her? There are men who are professionally brilliant, do not have hair on their head, not able to marry, not getting good promotions, losing their entire confidence. Is this vanity? A young boy, goes swimming, has large breasts, is teased by everyone around, loses his confidence, not able to concentrate on his job, his studies, or sports. How is this vanity? So, plastic surgery is essential in at least 80% of patients. It has to be seen with an open mind. It has to be seen that it is life transforming for everyone.